head shall be exalted. And every hill and mountain shall be made low, the rough places will be made plain, and the crooked places will be made straight, and the glory of the Lord shall be revealed, and all flesh shall see it together.
We have not even to risk the adventure alone, for the heroes of all time have gone before us. The labyrinth is thoroughly known. We have only to follow the thread of the hero path. And where we had thought to find an abomination, we shall find a god. And where we had thought to slay another, we shall slay ourselves. Where we had thought to travel outward, we shall come to the center of our own existence. And where we had thought to be alone, we shall be with all the world.
Hello, everybody. Hello, world. I'm Roberto Takaoka. I am the Vice President of ISAD, and I welcome everybody to this Organization of Care in Atopic Dermatitis meeting. It's a very special moment for us. Thank you for your participation. I would like to explain the video that you just saw, so I'm gonna try to explain that to you before we present our speakers and our chairs. Okay, the video that you saw is from Joseph Campbell's Power Myth series that they showed on TV a while ago, and I'm pretty sure that the hero's journey is what the patient's journey is based on. And Joseph Campbell is a famous American mythologist, and then he noticed that there is a pattern that every person goes through when we have a problem in our lives. So, for example, when a patient has a symptom and he's doing whatever he has to do, and then something happens as far as the health, and that's what he calls the call to adventure, and that's when the adventure starts. And then the hero goes through a lot of steps, and he meets helpers and mentors that could be the doctors that they go to. And then they have challenges, they have their crises, their flares, and they go through a lot of ordeals, and then they go through a transformation, they go through a learning process, and they finally come back to their lives with some kind of learning, and often they bring some kind of what we call an elixir or a kind of medication, and they actually improve. So this kind of pattern is very common, not only for patients, for everybody when we face a difficulty. So this is the basic patient journey. You have a symptom, and you have a diagnosis, you go through treatment and recovery. And this is another more complicated one, and this is what's called a patient journey of the future. There's a lot of pharmaceutical companies that are also studying these, and of course, all AD organizations are doing a lot of design thinking workshops, and so this is a kind of labyrinth that the hero has to go through to improve his problem. So I won't go through all this, but you can notice from when you talk to a patient that they've already checked on the internet. Sometimes they even had a telemedicine consultation. When they finally get to see a dermatologist, they've gone to a lot of other procedures, and so this is basically what we're going to talk about today. So I've done my introduction. I'm going to introduce our distinguished chairs, but before I do that, let me just describe briefly the program. Amanda from the Eczema Society of Canada is going to talk about the atopic dermatitis patient journey. And Professor Young-Jung Kim from South Korea is going to talk about designing new patient educational tools. And then we have Sophie Mehi and Fanny Santonac from Eczema Foundation. They're going to talk about their experience with patient journey. And we have two Brazilians, Enrique and João Pedro. They're going to talk about their YouTube project about for young people with atopic dermatitis. And then finally, Wendy Begoka is going to talk about an interesting app for patients with atopic dermatitis. And then we will have a final discussion. After each presentation, we'll have a very short 5-minute discussion. So I ask you to ask questions through YouTube, and we'll try to answer them during this session. So let me introduce our distinguished chairs. It's a great pleasure to introduce Howell Williams. He's the professor of dermatology and epidemiology in Nottingham, UK. And Jean-François Estalder, and he's an emeritus professor of dermatology at the University Hospital in Nantes, France. So thank you, Howell, and thank you, Jean-François, for being here. And I'll leave it to you now to moderate the session, and I'll see you during the program at the end. Thank you very much.
Together, I'm sure your experience will be very useful for all of us. Please, Amanda. Oh yeah.
Hello, everyone. I'm just needing control of the slides. So hello there to our moderator. I'm just needing control of the slide deck. If you can kindly advise on that. And thank you for welcoming me here today. My name is Amanda Cresswell-Melville. I'm the Executive Director of the Eczema Society of Canada. And we're just waiting for the slide deck to be up so that I'm able to advance the slides. I'm sorry, there seems to be some technical challenge here. I don't have the slides on my screen. I'm just waiting for Laurent. So I'll start anyway, just so that we don't lose too much time while we wait for the slide deck to come on. So Eczema Society of Canada endeavored to create an atopic dermatitis patient journey, whereby we would understand what it's like for a patient to go from first symptom to diagnosis to treatment throughout the journey. And in our research with our patients and our surveys, we really understood there are 3 distinct journeys, which I will speak about. I see from the technical note here, they are working on it. Okay, it looks like ISAT is sharing the slides. Okay, so wonderful. I don't have control yet, but it looks like they're passing me the controls. So you know what, I'll continue just so that we don't lose too much time while the tech team is working on that. So our goal for the journey was to better understand the experiences, the care, the treatment, and the pain points for patients along this journey. What we learned very quickly was that the patient path is not simple, is not linear, and is certainly not easy for patients and caregivers. We wanted to ensure that patients were represented authentically and have their experiences honored and validated. And we wanted to help multiple stakeholders understand the journey, the barriers for patients, the gaps in care, and how they can intervene. I still don't have control, but I'll just continue again so that we don't lose too much time. Or if Laurent out there, if you have control, can you advance the slides for me? I do not have control over the slides. No. So our methodology was we started with a group of patients who answered very in-depth questionnaires. We had over 30 questionnaires responded to, which really laid the groundwork for our patient journey project. Then we selected a focus group of 10 patients who were really going to be the ambassadors of this program and really help to bring the project to life. Then we conducted a survey. Just Laurent in the background, I don't have control, so it's showing me that I don't have control of the deck. I'm hoping that perhaps you can advance it for me. We used design thinking. So Dr. Roberto Takeoka really inspired us with design thinking that he presented a few years ago at an international meeting. And we used that program to help to inform our journey. So we used the concept of design thinking or human-centered design. And we actually had an expert in our focus group who is a patient in human-centered design, and she was able to help us bring the project forward with the design thinking process. So lots of iterations. We went back to the patient group. Did we get this right? We validated it along the way. Okay, here we go. Can we go back one slide, Laurent? So we broke the program into 3 maps. So again, we've seen some patient journeys in other disease areas. We've seen some patient journeys in atopic dermatitis that are very simple and very linear. But we really endeavored to get a true picture of what this looks like for the patient experience. So we have 3 maps that we broke this into. The first is the atopic dermatitis patient journey. And this is sort of the first journey from first symptoms to diagnosis to then finding treatment. Then the second journey is we call living with recurring flares. And this is for those patients who aren't controlled at that first journey. And then the third one we call crisis drives action. And this was a little bit surprising for us that so many patients, in fact, every patient in our group expressed that they had a crisis, a flare crisis during their journey. And that is what drove them to escalate care and typically get onto systemic or more robust medications. Whomever has control out there in the ether, could you please advance to slide 6? And if you could put it in presentation mode, that would be wonderful. If not, I can work with it. So this is the first journey, the atopic dermatitis patient journey. And you see, I don't have mouse control, but if we look at the left, this can happen in infancy, in childhood, or even in adulthood, whereby the first symptoms appear and the patient needs to seek help. Typically in Canada, patients reported they go to a pharmacist. So they go to that pharmacist looking for help and support. They get their first diagnosis, they have initial treatment, and at this point, they're hopeful. So they're hopeful that everything is going to go well. Okay, I think he's bringing me back up to speed. Okay, so in that first journey, I'll keep going just in concern for time. In that first journey, we're really looking to make sure that patients are managed. And you'll see here on this slide, this is perfect. Thank you to whomever's controlling that. Many patients here are managed, and this is more common in mild patients whereby they experience this management. Sadly, for many, they are not managed at this stage, and they go into, if we see on the right hand of the slide there, these flare cycles. So this recurring flares, adjusting treatment, going back to the primary care physician, they're getting frustrated, they're needing support, and they're experiencing financial burden. And you can see they also flare off the journey here, where they're looking for alternative therapies, they're cure seeking, they're really looking for that magic cream. If you could advance to the next slide. For the patients who are not managed at this phase of the journey, they move into the second phase of the journey. And that is living with recurring flares. So here they're seeking treatment adjustment. And this is where patients reported they're looking to see a specialist. And you can see a blockade there where they can't access the specialist. So this is either because they live somewhere in Canada where there is not dermatology specialty available, or their primary care physician is not wanting to put them on to specialty care, and that's a huge challenge. The second group experiences challenge in waiting. So the soonest that patients reported they can see a dermatologist is typically 2 weeks, but some can wait over a year to see a dermatologist. So if we advance forward to looking at the patient who's in crisis, I mean, how could you be in a crisis and wait a year to see the dermatologist? It just isn't practical for patients. So you can see here, we travel along this journey. We're seeking support. We're looking for specialist care. There's treatment adjustment. And again, we get to managed or not managed. And here, when they're managed, this again is good news. This is when patients feel empowered to manage their condition and treat their eczema, their atopic dermatitis. But there's still stress experiences when they have flares, and they still weigh the risks and benefits of treatment. So it's not that this is a simple pathway. But for those for whom they don't find management in this recurring flares, if we look to the right of the slide, you can see this is when they flare cycle, flares recur, they go back to the doctor, they adjust treatment, they treat, and they're experiencing isolation, frustration, the need for support, financial burden. This is where we get complications like infection, where there's hospitalization. And this is really challenging for patients. And if you look at the bottom right, we have little clocks all along the way, and you'll see that this for patients can last months, years, or even a lifetime. So this is really challenging for patients. If we can advance to the next part of the journey, we're going to now see this flare crisis. And this was really shocking to us in our focus group, that every patient in that focus group had had a flare crisis. And when we validated this, we validated the journey with over 1,000 survey respondents, and almost half had had a crisis. And patients in our focus group were really upset and almost felt angry that they had to have a crisis to get escalated treatment. I myself experienced this with my child. I had to take a photo of him sort of covered in blood after he'd scratched himself to the point of bleeding. And I took that to the doctor and said, this isn't normal. I need to see a dermatologist here. We need to escalate treatment. So each patient had a unique crisis. Some had had multiple experiences across their journey. This is where patients now typically report to emergency care or urgent care. Really significant mental health impacts here. They're feeling vulnerable, frustrated, and many you'll see they fall off the map, they quit treatment. So this is where patients really give up, and they give up on conventional medicine and sort of go into these really unhealthy behaviors. Patients reported coping behaviors and unhealthy behaviors, isolation, depression. If they do get back to care, you'll see there they escalate treatment. This is typically where we saw systemic medications, phototherapy, biologic therapies, but there's still worry, caution, desperation. That's why we have that caution sign there. And then they can move into the managed or not managed. Now, if they're not managed here, this is really the most desperate patient population, and we have to work really hard. Part of our solutioning for this journey is to really support those patients. And if they're managed here, they wanted us to be very clear with this journey that if they're managed at this point, they still experience worry and fear of relapse and stress, and they're still weighing the risks and benefits of treatment. So this is quite a complicated journey. If we could advance to the next slide. I'll speak a little bit about flares. Now, if we think of atopic dermatitis, we often think about it as clear skin, a flare, and then clear skin. Well, it's not the case. And I think many of us who've dedicated much of our lives or recent years to this would agree with this. Almost half of moderate and severe patients have a constant state of flare, meaning they have a baseline of AD somewhere on the body that's sort of quiet inflammation brewing. Then they have a peak and a worsening, and then they go back to some level of baseline. For mild patients, they do experience this. Most of them, over 90%, have clear skin, a flare, and clear skin. So in looking at this, it really sort of gives us a shift in how we look at treating atopic dermatitis. When we say, use your topicals, when you're clear, you can stop. Well, for many moderate to severe patients, they don't ever get clear, even with topical medications. And if there's patients out there, I'm sure you can relate to the frustration that you're adherent to your plan and you're experiencing a flare during treatment. So we have to do something to get these patients into a better state. If we could advance to the next slide. And whomever's doing that, I appreciate your diligence in listening here. So just some data highlights to wrap up. 43% of patients trust their healthcare providers. The sad news is that the inverse of that is that half don't, and that is positively correlated with severity. So the more severe the patient is, the more trust they have lost. If we can advance to the next slide, we will look at data related to patients feeling let down by their treatments. So almost half feel let down by their treatments. And again, this is positively correlated to severity. So the more severe a patient is, the more commonly they experience that. If we can advance to the next slide, I think this is a heartbreaking stat. 41% of caregivers feel like failures. And I tell you, I feel this myself. We know logically that we didn't cause this and that we don't cause the flares, but we really feel it as caregivers. So there's a lot of burden here to caregivers as well. If we can advance to the next slide. Patients and caregivers worry that healthcare providers won't see their skin during a flare. And there's wonderful interventions like apps and photo collecting apps and tools that can help with this. They worry that doctors won't examine their skin. And we actually have a dermatologist in Canada here who has patients put on a gown and then examines all their skin. And that's a common complaint from patients, is that their care provider doesn't even look at their skin and they feel dismissed. And we also want to address the needs of patients with skin of color. So this is very common, whereby either the hypopigmentation or hyperpigmentation, even after the flare is perhaps under control, these can be distressing. So the loss of pigment or the darkened pigment can be really distressing for patients. So we also don't want to forget to address that. If we can advance to the next slide. In summary, we're now working to action this journey. And I know there was a lot of information on the journey there. I had to go through it quickly because of our little tech hiccup there. So I would encourage you to please go to our website, look at the journey, please enjoy it, pour over it, look at all of those steps along the way. But patients need compassion, empathy, and understanding. You can go back actually one slide, unless we're running out of time. And with this global community, I really feel that we have a wonderful team here that are going to help eczema patients. So thank you, and I hope that was helpful.
Okay, it's up to you, moderators, for the Q&A session now.
So I'm ready for questions whenever anyone has one.
I'll step in. Jean-Francois seems to be having a problem there. So I'll step in. Amanda, I think you did really well. That's the first thing to say. You kept calm. So well done, Amanda. We do have a question, and you're sort of it was about a question from Amanda Roberts. Is the journey the same for different skin tones?
Hey, excellent question. So when we brought together those 10 patients plus our moderator at our focus group, the journey was common, but patients really wanted to say that they needed to feel unique and that they were being treated as an individual. In terms of skin of color, we're hearing from patients that really needs to be addressed, and the hypo and hyperpigmentation is really a big key issue. Some of the patients in our focus group and some who've written for Eczema Society of Canada, you can read their journey. Sometimes the scars or the ashes that are left after the flares and after the flames of atopic dermatitis can be more distressing than the symptoms themselves. So we really need to look at addressing those concerns for patients.
Excellent. Thank you, Amanda. And I have a particular interest in black dermatology, and you mentioned the word scars, because very often parents say, oh, the creams have scarred my skin, doctor, whereas it's not, it's just the footprints of inflammation, as you see. So if there is anybody online wishes to ask more questions, we can certainly pick up on issues of skin of color. Thank you. I don't see any more questions. Just one quick question from me.
Yes, please.
Amanda, and that is, you mentioned flares, but some people, of course, they have a continuous course and no flares. So are they part of your group, and are they considered as the people who just never get flares? They just have a continuous course of AD.
Yeah, so we consider them the constant state of AD. That's what we sort of called it after consult with this patient group. So we call it constant state of AD. They may have exacerbations or worsening, but they always have some low level of atopic dermatitis. And those are the patients who really should be in dermatologic care in Canada. That's really our message. They need to be seeing a dermatologist. There is help for them. And that's our message too. We don't want them to feel hopeless. There is quite a pathway of treatments available. And if they work with a dermatologist, they should be able to get help. But absolutely, that is most moderate to severe patients are in that category. So that's a really important group. So thank you for bringing that up.
Thanks, Amanda. Just one last question coming in before we move on. This is from Sebastian Barbaro. How do you see the role of the GP, or the family doctor, general practitioner, in the patient's journey in Canada?
Yes, I love that question. Thank you for asking. So we think the primary care provider, or the GP, is so important. They're doing most of the diagnosing. We know that. They're doing a lot of the care. So we really want to see a care team built. And that's what our patients came up with in our focus group as well. Dermatologist working with GP, working with pharmacist, and with patient with a seat at that table to build the treatment plan for the patient and get the best care, and listening to the patient voice. So that's an excellent question. Thank you. And we have endeavored as an organization to help educate primary care providers with accredited or certified CME programs so that GPs are better armed to deal with atopic dermatitis and manage these patients. So excellent question. Thank you.
Thanks, Amanda. Once again, I thought you did really, really well under a very stressful situation. So thanks very much, Amanda.
No trouble, my pleasure. Thanks.
Jean-Francois has overcome the problem with his mic. I tell you what, Jean-Francois, why don't you introduce the next speaker? We're going to swap our order, but this is the joy of working in the moment. So Jean-Francois, are you able to unmute and introduce the next speaker?
Yes, please. I'm so sorry because I was lost. I have no Zoom on my screen, so I was a little bit disturbed by that. So thank you, Amanda, for your very brilliant talk, and I think very interesting one. So the next speaker will be Hang-Yeon Kim from South Korea. Please, Dr. Kim, you will speak about designing new patient education tools. It's a very interesting field. So thank you for your presentation.
Thank you for the nice introduction for me. This is Dr. Kim from Korea. Today I will talk about this magic box to educate the patient. I will share my slide, and then we will share our idea about that. Please wait, I will share my ones. Okay. Slideshow. Okay. This is my great honor to have a chance to present my talk about idea designing new patient education tool in atopic dermatitis. I am Dr. Hyun-Jeong Kim. I worked in the Sejong National University Hospital in Korea. We have set up 6 education centers with a special focus on the education of children and their caregivers for the following reasons. The first, in particular, allergic diseases in children and adolescents have higher prevalence than adults, and if not properly managed, they become serious disease in adulthood, causing great economic burdens and loses their quality of life on patients, families, and society. This photo documented those activities. These days, many YouTube videos are being produced because they deliver a lot of information through YouTube. As shown in the picture on the top right, patients and their guardians diagnosed with atopic dermatitis However, as such a project continued for 10 years and 6 centers randomly have created materials for education, the problem was discovered that there was a shortage of materials containing necessary information when trying to use materials to actually educate a patient in the clinic. There are 3 problems. One is the inconsistency of educational materials for its 6 centers, and second is the deliver only ordinary general theories, not sophisticated ones to the patient. Last one is in the actual treatment field, necessary information is not provided, and unnecessary repetitive education is being performed on the usual contents. In other words, we need new education tools not for providers, but for users based on service design. This project was supported and funded by the Korean Academic Society of Atopic Dermatitis. The reason why we use the methodology as service design, I have expressed many projects related to healthcare service in Human Understanding Design Center, Seoul, Korea. Traditionally, service design is described as a process in 4D, in the process of finding the problem, narrowing the scope of the problem, expanding wide variety of ideas about the refined problem, turning it into an ideal solution, and deliver the final result. This is our previous project, the well addressing for atopic dermatitis patient tutorial video. We asked to solve this problem by using the service design methodology. The first thing we did was to collect the people involved, video creators, designers, doctors, nurses, partners, and caregivers. At the same time, we collected all the related materials such as existing manuals, explanatory materials, and YouTube to analyze the problem. After that, we presented various ideas related and made a video like this picture. The patient became the main character of the video, and the mother attended as one of the producers. Finally, we got the nice product and uploaded it to YouTube. Whenever I want to let my patient learn this complex dressing method, I link the video and explain the method together. Rather than simply explain the dressing method to the patient in words, if we explain it while watching a video, the understanding of the patient will increase. And the patient will actually perform the dressing sufficiently, making it the best rescue method. It is included in the patient action plan so that it can be used effectively in a worse situation without urgent access to the hospital. This service and design methodology was applied to this project as well. First of all, we obsessively gathered all the atopic education materials created by the 6 existing centers, and all the materials created by various academic society and regional government. The next step is to hear real voices from patients and caregivers. In the Seoul Atopic Asthma Education Information Center, there were more than 8,000 cases data in which patients and their guardians visited directly or through telephone counseling. We intended to use the developed data as a basis to find out and how well the educational materials we have created for last 7 years actually match the question and wants of our patients. After analysis of the data, we understand the limitation. Our materials don't contain the question which the patients really want to know. They just describe the disease definition, pathogenesis, aggravation factor, treatment, and so on. These are repeatedly listed without system, without being able to distinguish between actual patient's question or need to know. They just mimic the textbook. But the real voice from the patient is so different. They want to know the genetic inheritance, prognosis, the cure rate, what kind of food is helpful, chocolate is good for, bad to atopic dermatitis. The other limitation is the educational content without a distinction between infants and toddlers, school age lower and higher grade, and adult. To put it in extreme terms, the staff of the training center in charge of education unilaterally conducted training hours rather than educational material tailored to each patient's situation, without considering age, severity of the patient's disease, treatment history, and deteriorating factors. It means that we have provided uniform education to our patients. All of the existing materials were ripped out page by page and applied to all the keyword mappings for atopic dermatitis that we created according to the content. Primary mapping was conducted focusing on the definition, diagnosis, cause, treatment, management, and exacerbation factor for atopic dermatitis. Then by analyzing the database constructed with the patient, we added the missing ones as element of the mapping keywords. Caregivers and patients were very curious about the genetic link, but none of the data mentioned it. Patients are curious about the prognosis of whether the disease will last for a lifetime or will heal soon. But none of the data mention it. I wonder if the flower and eggs are the causes of atopy. But none of the educational materials have mentioned this. We have edited the missing content as keywords for the new mapping. Recently in Korea, atopic dermatitis often worsened by fine dust from China, so it was reflected as a new keyword. And we also considered indoor environment pollutants such as phthalates as a keyword for easily questioned. We also included a question about probiotics, breastfeeding, vitamin D, and even in primrose oil. Of course, we had to create a new educational material for the new keyword. Whenever we teach real patients in our office, we should not be teaching them in academic language. Education material must be made using their language that they can be understand easily. All of this based on the data that patient asked us so far. Since the materials we have created for the last 7 years are very supply oriented. In order to overcome this, we analyze the patient curiosity, mapping the keywords, and combine the parts of the existing material and the parts that were not served by the existing material. We made it as user-oriented ones. After mapping was completed, educational material for each keyword were created by experts. The primary product was shared with the LLF academic societies such as the Korean Academic Society for Atopic Dermatitis, the Korean Academic Society for Asthma and Allergy, and the Korean Disease Control and Prevention Agency, and carefully examined whether there were any academic errors. How to convey information was a big concern for us. Existing booklet would be thrown right in the trash, no matter how much they give a patient. We decided to intensively conduct education in the training room inside the hospital at the patient home, and considered finding the easiest way. We thought that the first occasion in our life was the word card. It was adapted to our project by simply showing the keywords designed by a patient with the image on the front side, describing details on the back side, and teaching them while reading together. It's a card method to pick only what the patient wants and see. In Korean, sok means picking only what you want. So this education material was named as Atopic Dermatitis sok card. There's a Korean proverb that good-looking rice cakes are good to eat. Accurate information has already been obtained to patients, and we invited designers to communicate this visually and effectively. They majored in visual design and interactive design and had previously participated in the Hospital Innovative Project and our Service Design Center several times. They designed and created all the education materials themselves. A wonderful design product that takes into account the color to give a patient a lively image came out. For example, the most common negative factor is pets, and patients are often curious. This is a card about pets. It also explains why pets can make atopic dermatitis worse and summarizes how to deal with these small infographics at the bottom. It consists of 56 cards in total. We still have a Korean version, and if we have a chance, I'd like to be able to share it with you in English. My little girl and colleagues finished this one, translated it to English as their volunteer works. In order to use this card, the patient or parents are asked to indicate in this checklist what they are curious about. These patients have already been diagnosed with atopic dermatitis, and although all these things are necessary to be explained again, our goal is to pick out what the patient really wants and concentration on it. Or if the must test that the patient was diagnosed with atopic dermatitis in my office, and the must test performed to find out the worsening factor during the treatment shows positive to house dust mite, mark the house dust mite on this checklist and ask the patient to pick up this and go to the educational nurse. The nurse takes the card for the question out of the box and they explain the following. In this box, the patient and the counselor will speak after taking out the card with the answer to the question they want. It is extremely interactive consultation. We do not give a one-sided explanation. If we draw a card of house dust mite, you will find the following explanation. House dust mite is one of the common aggravating factors for atopic dermatitis. If you want to control this, please clean up your blanket with high temperature water and so on. In these days, all medical treatment is going to be personalized one. I think our new educational tool is the one of the future personalized atopic dermatitis education tool. It's not enough time to tell a lot in a short time, but thank you for your listening and thank you for your attention.
Thank you so much, Professor Kim. It was very, very interesting. So maybe we have some questions coming from the audience.
Yeah, thank you. Thank you for listening.
So, because you used the very with a very question for you. How? Oh yes, the question from Roberto Takauka is how is the partnership between designers and doctors?
Because we are the co-worker, because we have a lot of experience to share the patient journey, and then we just let the designer know what is the real voices from the patient and doctors. Because in my thought, atopic dermatitis education is very important in the both aspects. The patient is one of the axes, and the doctor is one of the axes. Designer is the modulator to share their both ideas, and finally they can make the very nice journey and the nice materials to educate the patients.
Just a question now, nowadays with the COVID pandemic, we use more and more virtual workshop. So what is your experience in this approach? Did you use the virtual workshop for developing this educative approach?
Yeah, because during this kind of workshop, we just invited the designers, because the designers is totally different from the medical doctors. Medical doctors just focus on the pathogenesis, treatment and so on. But designers can collected the idea, which is patient-oriented one. So the best workshop is together, the doctor, the patient, and designers, and all caregiver, the stakeholders must get together. If it fails, the work is not good for all the members in the atopic dermatitis education.
Thank you so much. So you will discuss during the last part of the meeting. So please, I will.
Thank you so much.
Thank you.
Bye.
Thank you, and merci, Jean-François. So we now move on to Sophie Marie and Fanny Centenac. So Sophie is a pharmacist and director of the Eczema Foundation in Toulouse. And Fanny is an expert patient, but she's also author of a blog, a famous blog called Bienvenue dans ma peau, le blog. So over to Sophie and Fanny.
Thank you so much. I hope you can listen to me. Yes, you hear me? Fine. Thank you. Thank you, Roberto, for giving me the opportunity to present the actions of the Eczema Foundation. I would say that we have oops, I don't see my presentation anymore. Okay. Maybe I will leave it this way, because if I move to the next slide, I lose it.
It's okay like this,
Okay, so the foundation is a corporate foundation of Pierre Fabre company, and it is exclusively dedicated to eczema, for better living with eczema. I have to highlight that even if we belong to a pharmaceutical company, we have no right of doing any promotional action for this company. So we can distinguish two steps in the history of the foundation. From 2004 to 2019, it was the setting of the foundation. It has been done with the help of many healthcare professionals, and this has helped the foundation to get a recognition by the medical community. It was created by Mr. Pierre Fabre. Our first name was Fondation Dermatitis Atopique, and then we moved last year to Eczema Foundation, or Fondation Eczema, for a better understanding for the patients. During this period, it has been a co-creation period with HCP involved in therapeutic patient education, in order to improve the management of AD by the patients and the parents. And so the foundation has contributed to the creation of approximately 40 atopic schools all around the world. You can see here what is this kind of school. So they are workshops organized within dermatological wards of different hospitals, where the healthcare professional receive the patients to give their workshops, their education workshops. There can be some workshop for children, for teenagers, and also for adults. The foundation has helped also the healthcare professionals to develop new educational tools. So we can see here, this is a kind of cartoon where we explain for the children how to apply their emollients, and we have another one for applying the TCS. And we have many tools like that, a little bit like the one that Dr. Kim showed just earlier, to help with managing the disease. We started to organize some events. We call them Sports Day. It was with the help of some very famous sport people. The idea was to convey patients and their parents that sport is very good when you have when you suffer from atopic eczema, and that you can practice sport if you just apply very simple advices. Then we met Fanny, and Fanny will talk about her story. We met Fanny in 2017, and we helped her to train and to receive a 40-hour TPE training. So now she can be considered as an expert patient. She will tell about her life. So I don't say any more about Fanny, but thank you very much, Fanny. It was such a nice meeting with you. And we also created with Fanny a web series where Fanny is talking about her life, and it's a kind of testimonials about 20 different short videos. We launched, of course, different social medias, because if you want to be visible, you need to be on the digital tools. So we are present on Facebook, YouTube, Twitter, and LinkedIn. And then the second phase of the life of the foundation was from 2020, where we have been placed in within the Pierre Fabre group in a new department called patient centricity. And so we are having some new direction to be closer to patients, but of course we don't forget, and we still are close to healthcare professionals. That's why we have done a certain kind of actions, like partnership with Global Skin to help them with the organization and the digital part of the World Atopic Eczema Day. We will organize on November the 20th a digital design thinking workshop with the help of Roberto. And we are more visible in some kind of disease awareness events. So we were present during the Tour de France this year. We had a booth, and we gave some advice to patients during this big event. We will try to have a meeting, a presential meeting next year with patients, but also healthcare professionals, and with some representatives from different patients' organizations. So the idea of the foundation is really to strengthen this alliance between the patients and the healthcare professional. So now I think I will leave the floor to Fanny to explain her pathway. Thank you very much.
Hi, everybody. Thank you very much for giving me the opportunity to talk about my story. I'm Fanny, and I'm a patient suffering from a severe atopic dermatitis since I was born. The title today, The AD Patient Journey, inspired me a lot in finding a new perspective to tell my story that I've told so many times before. I borrowed one major rule of storytelling from Pixar that says that you like a character, a hero, more for his achievements than for his successes. So let's hear the story of a little girl. Once upon a time, there was a little girl born with an extraordinary skin, a dysfunctional and fragile skin, a dry and reactive skin, which was an enigma for everybody in the 80s, and which left the whole family very upset and distressed. Every day she tried to live her life despite the physical and moral suffering. Every day she had to endure the lack of answers from the medical profession, the violence of school and social bullies, the huge feeling of guilt on her parents and on her. Too often doctors be like, "You are too stressed, that's why you're sick. You have to stop making yourself sick. The treatment doesn't work because you're not doing it properly. Look, your parents are doing everything for you to be okay and still you're not." Against all odds, this little girl managed to live a more or less normal childhood, but no one was treated her normally. Her parents, of course, were overprotective. Her brother hated her because she stole all the family attention and it was hard on him. Other kids were rejecting her and her true friends precious and rare. The doctors never listened to her. Even worse, they ignore her feelings until epic moments, like for example, that day when she was 8, standing on a chair in her panties and saw a dozen of interns, all of them raving about the beauty of her wounds, commenting on her skin like she was not even in the room. But believe me, this little girl for sure could talk, but it was as if nobody could hear her voice screaming from the inside and boiling under her skin. She realized very quickly that doctors would never be able to help very much, and that her parents would do anything for her. Hydrotherapies, thousands of creams, alternative medicines, and the list went on, including excessive consumption of oral steroids with heavy consequences nowadays. She even tried the famous creams made from tacrolimus, which they thought for a moment could be the miraculous cure that everyone was looking for. Thanks to them, she even experimented a bit life without eczema, but it was not a miracle. It never was. Nothing would ever work for more than a few weeks, maybe months. Her rashes were back every time. Karma, maybe thinking that the message wasn't clear enough, decided to impact her more strongly. It was the last straw. Severe allergic conjunctivitis, vernal keratoconjunctivitis, multiple corneal ulcers. Come on, why me, she thought. But for the doctors, once again, her nightmare was an extraordinary treat. Can someone call Dr. House? Yet, growing up and still learning on a daily basis about her aggravating factors, allergies, nutrition, environment, moral aspect, etc., she fought not to let this condition define her. She even fell in love and had a beautiful baby boy, perfectly eczema-free, her masterpiece. Until one day, it was summer 2016, and she could not take it anymore, hitting rock bottom. She was skeptical, but her dermatologist convinced her to go back to Toulouse-Larrey Hospital to meet Professor Carl Paul this time. This meeting and educational therapy would change her life forever. For the first time ever, she felt safe, considered, and listened to with compassion and attention. The person in front of her was gentle and absolutely deeply convinced that he could do something to help her and improve her condition. This was the first, a very deeply emotional moment. Only a few minutes were enough for him to explain her whole dermatological history to the crew of interns following him everywhere. He then invited her to meet his multidisciplinary team to follow the TPA program in AD without ever clearly naming it. Smart guy. The first question of the nurse in charge was, "Are you ready to reset everything you know about your condition?" She answered, "I'm ready to walk on my knees to Bordeaux if you guarantee that it will improve my condition." After some session of UVA1 to be precise, the right dose and use of topical steroids, a strict order not to moisturize the rashes when inflamed, and to use petroleum jelly instead, and to moisturize the skin when it's okay. Her skin was incredibly tanned and brand new within a week. A week after 35 years of pure hell. She couldn't remember the last time she had seen her skin in such good condition. Despite her fears that it may not be the case, this brand new skin was here to stay. And here it is. The most astonishing is the virtuous circle. The symptoms gone, she could finally understand her illness better and learn to anticipate, handle, and prevent any signs that it might flare up again. Because I was this girl and this journey is mine, today my commitment to help other patients is obvious, especially as a patient expert with the Eczema Foundation. So many of them are still suffering in ignorance, still hoping for salvation from the right cream that does not exist, still fighting to avoid topical steroids like the devil, even if their skin is making them suffer like hell. I know that my story and my solution are not universal, but if my success story can inspire one person, then it was worth it. Yes, you can live better with AD. Yes, we can escape the episodes of flaring up and the vicious circle. And yes, sometimes it takes one doctor amongst hundreds of them to make it happen. Yes, knowing more about your chronic disease will help you to manage it instead of suffer from it. And yes, we as patients are totally part of the solution, and everybody needs to hear that, starting with ourselves. The salvation is not only in the doctor's hands. Educational therapy needs to go out of hospital. Please. It takes thousands of voices to share this message, and I will be one of them. Who will listen? Thank you very much for being here today to hear it.
Wow, Fanny. I salute you, and thank you, Sophie, for describing the fantastic work you're doing globally. Fanny, I see lots of messages coming in, saluting you, saying how brave you are, inspirational. And at one point, I was nearly in tears. It breaks my heart, particularly to hear about your story with doctors who just display you like a specimen or do not talk to you. So thank you for sharing that. And I'm so glad you found Carly Paul. I know Carly, he's a wonderful man, and I know exactly what you mean. So thank you for sharing that. And Sophie for describing your work program as well. I'm seeing a question here from Roberto Takaoka, and it's a question to Fanny, and that is, what do you expect from doctors? Or can you say something, what should doctors definitely not do? Fanny.
I would say that doctors should listen for sure to patient, because even if they know how the skin works, they don't know the story of the patient, and the story is so important, and the emotion of the patient is so important. And Amanda said it earlier, when there are severe forms, more the patient is suffering and more is losing trust in doctors. So when you have a severe case in front of you, please take care, be compassionate, be full of empathy, because of course he's having such a hard journey. He needs you to listen and to personalize, to customize the treatment, because he tried already so many stuff.
Yeah, that makes so much sense. It's about listening. As doctors, you're often just taught to diagnose, but as you say, when it's somebody with atopic dermatitis, there's a person behind that. there is a story behind that, and it's about tailoring the treatment and personalizing the treatment to fit in with that patient's journey. So tell me, Fanny, a question. When you did see Carly, Paul, what was the defining moment? Was it the way he looked at you? Was it the way he listened to you? Did he shake your hands, or did he touch your skin carefully, or what was it that suddenly made you trust him as this person cares about me?
I have to tell you that after meeting him, I cried for 2 days straight because I was completely upset by this meeting, because for once I met a doctor very gentle and compassionate who listened to my story, and most of all, he was convinced that he would do something for me. And this was the difference, because before I used to meet professional asking me, did you try this? Did you try this? It didn't work. I don't know what to do for you. But this one, he was saying, we will try this. We will try this. And if it doesn't work, we will try this. Anyway, we'll find something.
So it sounds as if it's giving you hope. And
yes.
Sophie, do you want to comment on, Fanny has told her story, but is this a very common story that you hear, Sophie?
Well, what is very important with Fanny is that she controls her disease, and she has such a hopeful talk. When we invite Fanny to talk with other patients, she brings them up. She's so good with them that she can be she's more listen than could be listen professional, because she has been a patient and she's still a patient, but she controls her disease now. So she has such a power. She's very powerful.
Very good, very good. It's called street credibility. Absolutely, absolutely. I just see one comment here from Nala, who asked a question earlier. So Nala, thank you very much. And can I thank, we have 164 YouTubers listening at the moment. So thank you all very much indeed for tuning in and sharing your experiences and asking questions. So Nala is saying, is there one magic solution? In your case, Fanny, it was UVA1, or is it more about pulling all the levers you have? In other words, being holistic?
No, there is no miraculous cure. I wish. And if there was, I would have found it, believe me. But there is no. The miracle was educational therapy to understand exactly when to put cream, how to put cream, how to have a surveillance of your skin and detect the signs of flaring up and everything. This was the cure. And I think also half of the I don't know how to say, half of the path is also the personal path with my own emotions, my environment, my allergies and everything. So I think just Paul was a miracle because he arrived at the right time for me. He was the right doctor at the right moment.
Great. And it's about how to apply things and not just giving you things. So that's really very helpful. Sophie, Fanny, thank you very much indeed. We'll pick up some more questions towards the end. I'm now going to hand over to Jean-François. Jean-François.
Oh, sorry.
Sorry, Jean-François, you've muted yourself. Do you want to try unmuting?
Right.
Better. Okay.
It's okay. Is it okay? I'm sorry. So now we have to move to the next presentation given by Enrique and João Pedro Souza from Brazil, the hero journey and the atopic popcorn, Brazilian Atopic Dermatitis Association. So very nice title. So please, Enrique.
Okay, thank you. I'd like to first thank ISAD for this inspiring and worldwide project. I hope this will be a great chance to talk and we work with other organizations. I'd like to thank you, Jean-Francois, for the introduction, and Haiwa as well, and for moderating these sessions. And Haiwa, as always, dressed to the nines. Okay, that's me. Okay, share the screen. And I'm going to start this journey, speaking of nines, back to 2009. That's when we I mean, the Brazilian Association, we organized the first symposium for 100 or 200 plus doctors and other healthcare professionals. It was one other way of sharing knowledge, medical and scientific knowledge to all dermatologists, allergists, and any other kind of doctors interested in or treating AD here in Brazil. But we always thought about treatment as a joint effort with doctors and patients as well. So a little bit back in some more nines in 1990, that's when we started our support groups involving patients and their families and other friends and doctors and psychologists as well, to talk about their problems, not just as a consultation. But even from that time, one main concern we had was how to address the AD issue with teenagers. When we think about children or babies, toddlers, they have their parents to talk for them. And adults, of course, they are able to voice themselves. But teenagers, there's an age group that's some specific issues is due to the age. I mean, there are the hormonal changes, but several things changing in their lives. The transition from high school to college, start working or start dating. The physical appearance starts to really be a burden, because everybody starts looking and they are concerned about their clothes, their appearance. And it's hard to have them, for instance, attending support groups. It's hard to have them talking to willing to talk to the doctors or to the families about the disease. So in 2015, we had our first major project, specifically directed to teenagers. For all the years before the 2015, we had some smaller initiatives to address the issue, but then finally, with the manga, it was a comic book specifically designed to talk to teenagers. It was based on a script written by a patient. The story was developed by a group of physicians, of doctors, psychologists, and patients, and even the drawings. The patient was the one who drew the manga. And by then, we found that the hero's journey was really a nice way to introduce the hero's journey into the patients, how to treat the patient, how to understand the patient, as Dr. Roberto showed us during the beginning of this session. Not only the patient, of course, but specifically for patient, it's kind of our life as a patient too. Our life is a journey as well. And then we invited the Jedi Council here in São Paulo to talk about the hero's journey, because Star Wars may be the most well-known example of application of the hero's journey into something that we know, the movies and the stories. And then here cover of the manga. This is the English version. We started with the Brazilian version in Portuguese, and we have other versions in other languages too. Then 2 years later, in 2017, we had a chance to invite Robert Walter to explain us. He came to Brazil and made a lecture. Robert Walter, he worked at the Joseph Campbell Foundation, and he actually worked with Joseph Campbell. And then we also invited the Jari Council again, because the time, I don't believe in coincidence, but 2015, 2017 were years when the final trilogy was released, Star Wars final trilogy. So the time was perfect to have them talking about again the hero's journey, using the Star Wars as a link and to reach the teenagers. And then this year, we had this project, the hero's journey, and it's a popcorn. There are actually 4 online meetings. They're hosted by JP Souza, who's going to talk a little bit later. It was the result of all these years thinking about how to address the issue of having the teenagers, enabling them to willing to talk to us, to the doctors, to other patients. And it was first supposed to be face-to-face meetings, but due to the pandemics, we had to change it to online meetings. And finally, Data Popcorn was another project, was a separate project, but we thought that it would be nice to introduce it into this Hero's Journey project as well. Was also a developing group. It took a few years for us to find the final design, the final shape, and it was nice. I think there's a picture. As I said, Star Wars became a nice way of using this project and involving the adolescents, the teenagers, because Star Wars is one of, not only for teenagers, but for everybody, but specifically for teenagers, is one of the favorites. Okay, not yet. Thank you, and JP will share his view on this project. Thank you very much, everybody.
Thank you, Enrique. Maybe could you share your screen in order to be able to see your presentation? I think maybe we can do that on the website.
No, I think something happened here because I share my screen here.
Okay. I'm not an expert.
Oh, okay, what I can do is just share just to show the images and try again. Okay, so
I think it's your screen's not. You're not seeing your screen. I think we should go to João Pedro, and then he can share his screen.
Okay, it's strange, but it's showing here. This I'm sharing it. Something happened here.
Let's see if João Pedro can share his screen. João Pedro.
Hello. So, hello everybody. My name is João Pedro Moura de Souza. I'm 20 years old, and I want to say I'm so honored, and it's a pleasure to be here. So now I'm gonna share my screen and show my presentation. So just a little bit.
Thank you.
So sharing. So now I'm sharing my screen. Just wait a minute. Yes, my screen is sharing right now. So my name is João Pedro. I'm 20 years old. Now I'm studying business administration, and I also have atopic dermatitis since I was born. And I was host of the Hero Journey project, and now I'm gonna talk a little bit. So the Hero Journey project was based on the Hero Journey history, of course, and this journey is not only for atopic dermatitis patients. It's for everybody who has a problem and need to deal with this and overcome. So everybody passed through this journey. So the show was divided into 4 episodes. The first one is the call to adventure, when the problems begin. So the atopic dermatitis strikes. And the second one is the belly of the whale, when we talk about the worst phase you can be at. So the problems of the atopic dermatitis. And the third one is about the trials. So it's when the problems strikes back, and you need to accept and have discipline to deal with this. And the last one is the lecture, talking about the treatments and the medicines. So during this project, I had the chance to talk and interview a lot of people, some dermatologists, psychologists, social media influencers, a computer engineer, and many of them are patients and have the atopic dermatitis. So we talked about the problems, how they found a new way to overcome, and I had experienced some similar situations, but I was able to improve by attending some support group meetings organized by the Brazilian Atopic Dermatitis Association, AATA, and by meeting some amazing people that helped me a lot, including my family and my friends, and that's it. So this project also introduced a new character to atopic dermatitis community, the atopic popcorn. And the atopic popcorn, it's a new way to talk and show the atopic dermatitis with a gentle way and easygoing way, and a little bit funny. So it's soft, and the atopic popcorn appeared in all the 4 episodes of the project, and talking, dancing, scratching, of course, and interacting with the guests. So the audience really love it, and the show have more than 2,000 views on YouTube right now, and the second season is coming in 2021. So that's it. Now I'm gonna show a short video about this project, but it's in Portuguese. Just a minute. So here is the video. Here's the video. Enjoy. So sorry, people. The video was without sound, was mute, but it's only to see the top popcorn interacting with us and how was the project, because it was in Portuguese. So that's it.
17:30.
Thank you. Thank you for all your attention. And one more time, thank you to be here. I'm so thankful.
So thank you, João, and thank you to the Brazilian team. You are really innovative, and you give us new ideas how to obtain a more efficient approach to contact the patient, to help them to live with the disease. So thank you so much. Do you have any questions?
So
I would like to know if how do you assess the efficacy of this popcorn approach? Did you do some tests before and after? Just a question.
no, actually no. So the Atopic Popcorn project was made by a designer in Brazil, and it's a whole idea based in the Atopic group in the association in Brazil, AADA, and it's a idea with ideas from a lot of people. It's not only for me. It's like a lot of people helping and creating the Atopic Popcorn.
Okay, and are the followers only patients suffering from atopic dermatitis or not? Is it open
Not
for
only.
public? Not only.
No, it's only for it's open for public, but it's more for the patients.
Yes. Okay. And a question to Roberto. Do you think that you can use this approach to obtain a better contact with the teenager in your clinical practice?
I'm sorry, is that a question for me?
Yes.
I didn't understand.
I mean, yes.
I think people ask.
Do you think that this popcorn experience is useful for the clinician? Do you have any benefits of that? Do you think that the patients are more open-minded to hear from you, to learn from you? Do you think that an impact on your medical approach?
Okay. Let me say something about this project, because I've been involved in the creation of this character, but it wasn't aimed at to be used by clinicians. It was more like interactions between public and the atopic community. Actually, between the Brazilian Association and the general public and and patients, of course. But for us, this name also, it's very interesting. Atopic popcorn, in Portuguese, we say pipoca atópica, which is even funnier. And so people thought it would be very interesting to develop a character that would personified atopic dermatitis is in a more gentle and entertaining way, instead of like a beast or something that we often see that portrayed. Atopic dermatitis is like a monster or a beast or something. And we thought that would be easier if we could use another kind of approach. But that wasn't targeted to be used by clinicians. But I guess we could start using it in the future. This is just the beginning.
Yes, perfect. I think it's a good idea to maybe to give a more positive image of atopic dermatitis sometimes, because I think explained by young teenagers, it's motivating. I think so.
If I may say something about the meaning also, popcorn, as João Pedro showed in the picture, it goes through a transformation. Yeah. It has to go through a fire and then it becomes a popcorn. Okay. And also in Portuguese, I think it pops. The word pops. We use this in Portuguese also. The skin pops when you have some problem in the skin. So there's a lot of connections with the word. So that's why we use it.
Thank you so much. I will.
Okay, so thanks very much. And when I was watching that video, João Pedro, we didn't need the language. I just was smiling all the way along. So it was really great. And thanks, Enrique, as well. Okay, well, I'm going to introduce then Wendy Smith-Bigolka from the US. And Wendy is Vice President of the National Eczema Association and is responsible for scientific and clinical affairs. We're looking forward to hearing from you, Wendy.
Well, thank you very much. It's that kind introduction. It's my honor to be here today. I appreciate the opportunity to share with you some exciting new work by the National Eczema Association that's looking to harness the patient journey through a new initiative in the mobile health space. So if you'll bear with me just one moment, let me share my screen. I'll get my slides up. Okay. Here we go. Okay, so first, allow me to introduce you to a new app called Eczema Wise. Some of the images of the app are shown here on the left. As I mentioned, it's a new app from the National Eczema Association, minted just a couple of weeks ago in its release. And it's available on both iOS and Android, and also as a mobile website. And in developing Eczema Wise, I'll talk a little bit more about what's included as our presentation goes on today. But we importantly worked with patients and caregivers within the eczema community, as well as healthcare providers who also conduct eczema research, to really outline a threefold vision for this platform. The first is around activating patients and caregivers in their eczema care. The second is around enhancing shared decision-making between patients and healthcare providers. And the third is around advancing eczema research through novel real-world data. And as I say at the top here of my slide, this is an opportunity, we feel, for all of those different audiences to turn all of the whys, all of the questions that we all have about eczema into wisdom, into whys. And so hopefully through the conversation that we'll have today, I'll be able to share a little bit more of that. So in developing each of sort of these visions for what this platform could be and how it could be beneficial to the community, we took a look at the challenges that currently exist within the eczema landscape. And the first two goals, as you might appreciate from that previous slide, they're actually very interrelated, and they really center on engaging patients and caregivers in their care through, first and foremost, a greater understanding of their disease, and then giving them a tool to be able to leverage that knowledge and information forward to fostering a conversation with their doctor, or whomever they engage in their healthcare journey, about what treatment approaches and strategies are going to be most effective for them to hopefully alleviate the diversity of burdens that they might be experiencing. And this is a really important concept for the reason that's up at the top here about that atopic dermatitis is common yet unique. And I think we've heard that theme come through in many of the presentations today. And I think what's widely appreciated, certainly amongst this group, is that while eczema, atopic dermatitis, is a very prevalent disease that can affect both children and adults, what perhaps is less widely appreciated is that while there may be these hallmark symptoms, redness, itchiness, dryness of skin, that the experience and actual burden of disease can actually vary between individuals, whether someone might have a more mild form of disease, someone might have a more severe form of disease, but even within the same individual over time, recognizing that this is a chronic disease for many individuals, you know, their perspectives and assessments of their own disease may change as their disease changes over time, as they continue to experience this disease over a lifetime. And we certainly heard, I think, in Amanda's presentation about that uniqueness being incredibly important in helping to lay out a treatment journey for them that is going to be the most effective. And as we think about how that experience might vary, you know, some of them are going to be absolute differences that we can quantify more effectively, and some of them are going to be more relative differences. Some of them are shown here on this slide, whether it's the severity of disease, the different symptoms that people experience, with what frequency, with what level of intensity, triggers, quality of life, different treatments that they've used. And certainly some healthcare system engagement and who they might engage in the healthcare system as well in terms of managing their atopic dermatitis, but also importantly, just recognizing who that information comes from, that we can get a very different perspective on things, whether we're talking to the actual patient and getting this perspective from them directly, or whether we're getting this information from a caregiver on behalf of perhaps a younger child. And then related to this understanding of the patient experience, or the patient journey, as we're calling it today, is incredibly important to not only the overall understanding of disease, but as hopefully we'll talk through on the next few slides, this understanding of what care choices we're going to be making on behalf of these patients, or these patients will be making for themselves related to their care. As we can all appreciate, there's a number of things related to eczema care that include things in both the self-care categories, such as bathing and moisturizing, trigger avoidance, perhaps some over-the-counter therapies, but then also, depending upon a number of different considerations, this can actually step up into some different levels of therapeutics that might include different prescription level drugs, or perhaps even some complementary and alternative medical approaches, of which there is a wide and growing number of these eczema patients continue to use. And then I think what we can also appreciate is that the complexity of these options, there's going to continue to grow over time. The drug development space for atopic dermatitis in particular is really growing quite exponentially. And of course, we anticipate many new drugs that are hopefully going to be available for consideration in the not too distant future. And then on the bottom here, treatment selection are really going to be largely dictated by an assessment of disease impact. You know, more recent efforts, I think, have highlighted that atopic dermatitis has a burden and range of impacts that is obviously significantly more complex than just what we see on the skin, which obviously makes the management of this disease incredibly multifactorial, incredibly complex. And it's probably very difficult to appreciate on both the healthcare provider side as well as on the patient side without some level of sort of tracking these things over time and understanding what might be changing and what might be the same. And but also getting and thinking about this patient tracking of information, it's important to make sure that this isn't really limited by only what can be remembered. I think we've all been patients and we've all gone to the healthcare provider office and had conversations with our doctors where we are talking about how has it been going and how well things have been working. And certainly, you know, what comes to top of mind is what's going to be shared. But the story for many individuals is often much more complex than that. And so in thinking about this is actually very important then to reaching obviously a fundamental agreement, not only on what the assessment of the disease looks like, but also on having a conversation related to what care pathways are going to be most effective and what's most important to both patients and healthcare providers in terms of trying to manage not only the symptoms, but broader assessments and impacts on a person's quality of life. So then the third aspect of the Eczema Wise vision really centers on advancing research through what can be described as the use of real world data. And while research has certainly made considerable progress recently in terms of understanding more of the mechanistic, more of the pathogenesis type of contributors to disease. We're still continuing to learn more all the time. There's still a lot more that has yet to be unlocked. And especially with this concept of using patient-reported data to understand the lived experience and potentially how those variables might affect treatment effectiveness outside the clinical setting. And what's important to note about that is that, again, you know, for the most part, we're not spending our time within the clinical office. We're spending the majority of our time out in the world, living our lives. And most of that data collection that occurs in clinical settings, whether it be in a hospital, in a community clinic, or in the pharmaceutical area, you know, clinical trials, that is all going to be very limited in terms of the type of information that it actually has. And on top of this, it's actually going to be somewhat limited in terms of its ability to have what is known as either patient-reported information, or perhaps even more importantly, patient-centric information, which is the idea that the information that is collected is the most important to patients. And this concept of big data, as I'm showing here on the slide, that's come up a little bit today, it's really center stage right now, with the idea that harnessing all of these different pieces of information that are essentially locked and siloed into different areas can actually be beneficial to maybe unlock different insights or gain different perspectives about a disease, or about different questions that might need better information or need to be addressed. But information that can be harnessed through big data or can be understood through big data is really only as good as the information that's available to feed this construct. You know, it literally is, it can only assess what it has. And so if you don't necessarily have probably the 99% of information that's happening in the real world, you're really missing a very key part of the equation here. And so this idea that filling this data gap could actually yield a much more robust data source to provide a much more holistic understanding of atopic dermatitis and other forms of eczema in a diverse population is very exciting. And so what that leads us to then with Eczema Wise is a framework that is what we call our track, learn, manage layout within the app. And so what we have designed to date are 9 different trackers shown here on this slide. For patients and caregivers, we're hopeful that the value of this platform is going to be a guiding mechanism to gain insights certainly about their unique aspects of their eczema, not only for their own benefit, as we've talked about, but to share it with their healthcare providers. And the 9 different trackers that we have here are developed in considerations with things that were both important to caregivers and important to healthcare providers. And then importantly, they were also developed with the idea to use validated tools where possible, not only for things that are helpful in clinical practice, and for those that are on this meeting that are familiar with the HOME initiative, that's something that we look to very significantly to understand. And then the other idea is that we recognize that they are validated research metrics as well. So the idea that the other trackers that are in here is that Eczema Wise also has things that are more exposure related, and it has the ability to track different environmental triggers and different things related to treatment and set different treatment reminders as well. Moving on to our next slide. Under our Learn tab, we actually have the ability then for people to, as they're inputting this information, to display weekly or monthly trend reminders. An example graph is shown here on the right-hand side. They can expand this or contract this, see different trackers as they see, as would be most appropriate for them. And then they can actually highlight different days that they have input information here and expand out this detail button down below to be able to see if there's any sort of correlations or insights from the information that they have put in with sort of peaks or dips in different tracker information that they have input. And then most importantly, while we're on this Learn tab here, I don't have a slide for it necessarily, but I just want to highlight that what we also have embedded in the platform is essentially a feed of National Eczema Association resources and other supportive educational information, so that as patients are sort of assessing their own trends, we have a way to give them information that's hopefully very meaningful and specific and directed towards sort of where they are at along their journey. And that is hopefully going to be valuable information as they continue to learn from their own unique experience with eczema. The last tab then is going to be our Manage tab, and then all this tracked information becomes the underpinning for that shared decision-making conversation that we've been talking about. So to facilitate shared decision-making, in this section, it's actually going to walk patients and caregivers through a series of questions that are going to provide some additional context, or what I like to think of as sort of the surround sound for all the information that they've been tracking on a fairly regular basis. It's going to have them sort of talk to and provide their doctor with information about what they want to get out of their next healthcare appointment. It's going to give them an opportunity to give some quality of life impact assessments using a tool called Skindex Mini. It's going to allow them an opportunity to use a decision aid to provide some context around what treatments they might be interested in learning more about, as well as maybe their preferences in treatment selection. Perhaps it's getting quick results, perhaps it's something that is more convenient, perhaps it's related to cost. All of these things are incredibly important and dynamic and may change over time. So this is essentially a way for a healthcare provider and a patient to sort of be in sync in terms of what they feel might be the best pathway given these different considerations. And then at the end of this, sort of getting ready for this appointment, there's an ability for a patient to then print out all of this information along with a graph of the data that they have in the Learn tab over a 90-day period. And hopefully what this will be is an efficient way not only for healthcare providers to get a sense of, in very quick sense, what has been going on with their patients since they last saw them, and hopefully then for patients, it's an easy way and convenient way for them to be able to have all in one place, everything that's been going on with them. They don't have to remember something on the top of their brain, and provide a sense of what's most important to them in eczema care. And they can either print this information off and share it directly with their healthcare provider at the healthcare visit, or they can, if outside the app, if they are so equipped and their doctor's office is so equipped with a patient portal, they could electronically share this information as well. And then the back end, as I've mentioned, is actually a robust, novel data source for research. So everything that is the back end of ExemaWise is really a growing database of what I have started to call real world data. Some of the information related to what's being called real world data is actually still being collected in the clinical setting. So this is actually an opportunity to actually find out what's happening in patients' lives and utilize that information in a way that will be meaningful. We also have the ability on top of the trackers to supplement this information with periodic surveys. And so what we're hoping is that at the end of this, we'll have a lot of different inputs from a very diverse group of patients and caregivers that are going to have a lot of different journeys with their eczema, as we've heard about already today, and hopefully turn what I think we have all probably experienced as more anecdotal evidence into quantifiable, validated evidence that can be shared and expanded on by others. And so in closing, we're at the National Eczema Association, we're just really excited for patients and caregivers that have already started using ExemaWise, and we're excited for more to be able to do so in the future as we help to recognize not only the unique experience and expertise of patients and caregivers that really they're the only ones in the position to be able to share, but not only the value of these contributions to their care, and then ultimately the additive power of all these diverse perspectives from the eczema community that could potentially, through advances in research, benefit everyone down the road. So we very much look forward to sharing additional updates in the future, and I greatly, again, appreciate the opportunity to share with you all today this exciting new work, and happy to answer any questions. Thank you.
Thank you very much, Wendy. That was fabulous, and particularly like the idea of harnessing big data. I see Amanda Roberts has commented, harnessing big data is such an exciting novel opportunity. Wonderful. And I particularly like your track, learn and manage, and the fact that it can be personalized and therefore empowering the patient in the consultation. Wonderful stuff. I've just seen we don't have a lot of time. We have about 7 minutes not only for you, Wendy, but if anybody else has a question on YouTube, I'm going to bring them in as well. But I've seen a question here come in from Roberto, a question for Wendy. How do you deal with keeping the messages, privacy issues on the app?
Yeah, no, that's a great question. And without giving away sort of the the understanding of the back end. We have been very considerate of understanding and building the database with data privacy in mind. And so the framework already has sort of inherent security measures built in. And as we are not necessarily directly connecting information to the healthcare provider's office, it really, the data privacy and ability to leverage that information is really with the individual patient to share it with their healthcare providers. And then on top of that, we don't ask a lot of personal information from our users. It really is a username and an email address in order to get them going. So we don't know a lot of information about who's contributing the data. And all of the data that we might use for research purposes is all done even further than that in a completely de-identified way. And so we're very cognizant of health data being incredibly private and personal, and have taken steps in developing the platform to keep it as safe and secure as possible.
That's great. I've just seen another question come in from Nala. When it comes to real world data, what's the most important type of data that you would like to collect from patients?
That's a great question. And I think the answer is we're still figuring that out. Okay. We certainly have worked with our patient and caregiver community to identify the pieces that we have in there, and are going to be continuing to engage them in wanting to know what additional questions they would like to see the platform ask and answer for them down the road. What pieces of information do they think are going to be additionally helpful to know for themselves or share with others, whether it be healthcare providers or friends and family that are, they just want to be able to provide an understanding of what their disease has been like in a complete way. So I think the answer is it's probably going to be a lot of different things. I don't think there's one particular thing, but we're really looking to get that guidance from patients and caregivers.
Just a final quick question from Suritha Kannenberg from South Africa. Will the Eczema Wise app become available in other countries because it's currently not available on the South African App Store?
So absolutely. So the app, as mentioned, it's available. The app itself is available just for US only, but the web version of it is actually available to be used internationally. Oh. So at this particular point, I can't speak to future plans for an app beyond US boundaries, but the web version of it, which is a mirror of everything that you would get in the app, is available internationally.
Thank you. Well, look, we've almost out of time, so thank you very much, Wendy. But I want to particularly thank all the YouTube listeners. There are about 180 of you online there. And I also wanted to reassure you that the presentations that you missed, and particular popcorn with sound, will be available on the website afterwards. So, if you're frustrated that, I wanted to see that, it will all be available afterwards for you. So don't fret. But I'd like to thank you all for tuning in. For me, well, I've enjoyed the meeting. And what is it that I've picked up? And it's the one word: story. It's journey, story. Where have you come from? Where are you now? Where do you want to be? And not just any story, but we all have different stories, whether you're an adult, an older person, a young child with a carer, a teenager, if you have skin of color, is it a different journey? Or these are the important things for me, is the word story, and the importance of respecting and paying attention and listening to that story. So I'd like to thank you all for tuning in, particularly the speakers and my co-chair Jean-Francois and Roberto Takaoka for organizing the meeting, and for our technical team for helping us to do the best we can. I hope you've enjoyed it. I'm just going to hand over back to Roberto to close the meeting out. Over to you, Roberto.
Thank you. Thank you, Hal. And thank you, Jean-Francois. It was a great opportunity to share all these ideas, and I hope we'll be able to continue with the organization of care meetings in the future. We started this meeting actually during the ISED in Kyoto, and Hal and Jean-Francois, they were there. And we continue with these meetings. We try to continue with them every ISED meeting, so we hope we'll do that. I would like again to thank all the speakers. It was great. We could stay here for another hour and we wouldn't be able to cover all the interesting material. But thank you so much. Hopefully we'll continue the discussion outside of the meeting. And I would like to ask you on behalf of ISAD, thank everybody. And please check the ISAD website for updates on new meetings and new projects. And I hope to see you soon in another opportunity. So take care, everybody, and be safe. Thank you very much. Bye.